Did you know that taking care of prostate health could be the secret to a longer, more active life without limitations? Many men ignore important signs and simple habits that can transform their quality of life. But calm down. Today, we are going to reveal 7 attitudes that you should avoid to protect your prostate and live healthier and more peaceful. Do you want to know how to ensure well-being and make the most of each phase of life? So stay with me until the end and discover essential tips that can make all the difference. Number 1. Excessive alcohol consumption, a silent enemy of elasticity health you can't ignore. Few men realize the devastating impact that alcohol, especially in excess, can have on prostate health and overall well-being. The habit of consuming large quantities of selected drinks not only aggravates existing problems, but can also trigger a series of complications that could be easily avoided. When you consume alcohol in excess, your body enters an inflammatory state that directly affects the prostate. This can result in uncomfortable symptoms such as a constant feeling of urgency to urinate, difficulty completely emptying the bladder, and even pain in the pelvic region. But the problem doesn't stop there. Alcohol also impairs the body's hydration, dehydrating tissues and hindering the normal functioning of the urinary tract. Urine, which becomes more technical due to lack of fluids, can further irritate the prostate, worsening symptoms. Furthermore, frequent and excessive alcohol consumption is related to increased oxidative stress in the body. This process damages prostate cells, reduces the body's ability to regenerate itself, and significantly increases the risk of more serious diseases, including prostate cancer. We cannot forget that alcohol also interferes with hormonal balance, directly impacting the production of testosterone and other hormones essential for men's health. This imbalance can further aggravate prostate conditions, making treatments difficult and increasing the risk of future complications. Therefore, moderation is essential. Reducing the frequency of consumption and opting for smaller doses can make a big difference in the health of your prostate. Beverages like red wine, when consumed in small amounts, can even offer antioxidant benefits that help protect against free radicals. However, these same options must be consumed with care, always prioritizing balance and a diet rich in natural foods. Protecting your personality starts with conscious choices, and excessive alcohol should be one of the first habits to be eliminated or controlled. More than a simple lifestyle adjustment, this change represents a direct investment in your health, well-being, and long-term quality of life. Number 2, excessive caffeine, a common habit that can harm your prostate. You may not even imagine, but breakfast, that afternoon tea, or the energy drinks consumed to keep your spirits up can be hidden villains for your prostate health. Caffeine, present in drinks such as coffee, black tea, soft drinks, and energy drinks, can act as a direct irritant to the prostate, aggravating inflammation and intensifying uncomfortable urinary symptoms. As it is a powerful diuretic, caffeine increases urine production, overloading the urinary tract and contributing to the feeling of urgency or increased frequency of trips to the bathroom. This cycle not only affects quality of life, as it can also worsen existing conditions such as benign prostatic hyperplasia, BPH, and make it difficult to sleep due to nighttime trips to the bathroom. Furthermore, caffeine stimulates the nervous system, which can cause muscle tension in the pelvic region, increasing discomfort for those who already face prostate problems. This effect is especially problematic for men who consume high doses throughout the day without realizing that they are aggravating their symptoms. But don't worry. You don't need to completely eliminate caffeine from your routine. Reducing daily consumption, opting for lighter substitutions, such as calming teas based on chamomile, fennel, or mint, can bring significant relief without compromising the flavor or moments of respite during the day. These options are not only gentler on the urinary tract, they also have relaxing properties that help reduce stress and improve overall well-being. Maintaining a balance in your caffeine intake is more than a matter of comfort. It's a practical strategy for taking care of your prostate health and improving your quality of life. Pay attention to this everyday detail and see how small changes can bring great benefits to your male health. Number 3. The devastating impact of cigarettes on prostate health. Why quit smoking now? Smoking is not just harmful to your lungs or heart. Smoking also poses a silent threat to prostate health. The toxic substances present in tobacco, such as nicotine and tar, impair blood circulation throughout the body, including the pelvic region. This reduction in blood flow compromises the oxygenation of prostate tissues, making their regeneration difficult and leaving the prostate more susceptible to chronic inflammation. Furthermore, studies show that men who smoke have a higher risk of developing prostate cancer compared to non-smokers. Cigarettes release free radicals in the body, promoting oxidative stress, which damages cells and contributes to the emergence of tumors. It doesn't stop there. Smoking can also worsen the symptoms of benign prostatic hyperplasia, BPH, such as difficulty urinating, weak stream, and feeling of a full bladder. Another alarming factor is that cigarettes interfere with the body's hormonal balance. Nicotine affects testosterone levels, which can further aggravate problems related to the prostate and male sexual health. Not to mention that smoking worsens immune capacity, leaving the body more vulnerable to infection, including those that can reach the urinary tract and, consequently, specificity. Quitting smoking may seem challenging, but the benefits will begin to appear quickly. Methods such as behavioral therapy, use of nicotine patches, prescribed medications, and support groups are valuable allies on this journey. Each cigarette less is a step towards a healthier life, with a lower risk of disease and a better quality of life. Remember, quitting smoking is not just about living longer, but living better. By giving up smoking, you are not only protecting your prostate, but also giving your body the chance to function fully without the barriers imposed by a habit that can be overcome. Number 4. Fatty diet and ultra-processed foods. A silent bomb for your prostate. If you regularly consume fast food, fried foods, or ultra-processed foods, you may be putting your prostate health at risk without realizing it. Diets rich in saturated fats, organic sugars, and preservatives are directly related to increased inflammation in the body, affecting metabolic balance and worsening prostate problems. These foods are important for weight gain, which is another significant risk factor for conditions such as benign prostatic hyperplasia, BPH, and even prostate cancer. Furthermore, the frequent intake of processed foods tends to lead to a hormonal imbalance, impacting testosterone levels and favoring the ideal environment for the emergence of prostate diseases. The lack of essential nutrients in these foods also weakens the immune system, reducing the body's ability to fight inflammation and regenerate damaged tissue. On the other hand, adopting a diet rich in natural foods can bring enormous benefits. Fruits, vegetables, and lean proteins such as fish and poultry are great options for preserving prostate health. Foods rich in lycopene, such as tomatoes, watermelon, and guava, are especially recommended as they have antioxidant properties that help protect prostate cells against damage. Swapping processed snacks for natural options not only improves prostate health, but also promotes more energy, stamina, and longevity. Small changes, such as reducing the consumption of fatty and ultra-processed foods, can make a big difference, ensuring healthy health and full functioning. Remember, the quality of your food directly reflects the quality of your life. Make smart choices to protect your health today and in the future. Number 5. Sedentary lifestyle, the hidden enemy of prostate health that you need to combat. Leading a sedentary lifestyle doesn't just affect physical fitness or body weight. This habit can be extremely harmful to prostate health. Lack of regular physical activity compromises blood circulation, especially in the pelvic region where the prostate is located. This insufficient blood flow can cause inflammation, worsen symptoms such as discomfort, and increase the risk of conditions such as benign prostatic hyperplasia, BPH, and prostatitis. Furthermore, a sedentary lifestyle is closely linked to the increase in obesity, one of the main risk factors for prostate problems. Men who are overweight or obese are more likely to experience severe urinary symptoms and are at greater risk of developing recurrent prostate cancer. Inactivity can also lead to metabolic imbalances, such as insulin resistance, which affect overall health and worsen prostate conditions. On the other hand, including physical exercise in your routine brings benefits. Simple activities such as daily walks, stretching, or water aerobics help improve circulation, reduce inflammation, and control weight. Additionally, regular exercise releases endorphins, promoting emotional well-being, which also plays an important role in men's health. It is not necessary to practice intense training to see results. The important thing is to keep the body moving and avoid long periods of sitting, which can increase pressure in the pelvic region and worsen symptoms. Remember, practicing physical activities not only prevents prostate problems, but also improves your quality of life as a whole, increasing your energy and prolonging your longevity. Number 6, the importance of hydration, because not drinking enough water can harm your prostate. Drinking too little water is one of the simplest mistakes, but also one of the most detailed for prostate health. Insufficient fluid intake causes urine to be more specific and acidic, irritating the urinary tract and prostate. This lack of hydration also increases the risk of urinary infections, which can reach the prostate and cause painful inflammation, such as prostatitis. Chronic dehydration directly affects the functioning of the urinary tract, making it difficult to eliminate toxins and overloading the bladder and prostate. This can worsen urinary symptoms, such as difficulty urinating or a feeling of not completely emptying the bladder. Furthermore, a lack of water can make it difficult to diagnose serious conditions, as prostate infections or inflammation can be confused with urinary problems caused by high urine concentration. On the other hand, staying hydrated has considerable benefits. Drink about 2 to 2.15 liters of water to help dilute urine, reducing elasticity and improving the healthy functioning of the urinary tract. It is important, however, to avoid drinking excessive fluids at night to prevent frequent trips to the bathroom that can disrupt sleep. Prioritizing water as your main source of hydration is the simplest and most effective way to protect your prostate health. Avoid substituting sugary drinks, energy drinks, or soda, which can further irritate the urinary tract. Small changes, such as carrying a bottle of water throughout the day, can make a huge difference, ensuring a healthy body and a well-functioning prostate. Number 7, ignoring doctor appointments and warning signs, a mistake that can cost your health dearly. Failing to visit the urologist regularly or ignoring symptoms such as difficulty urinating, weak stream, pelvic pain, or constant urge to go to the bathroom can be a serious mistake for the health of your prostate. Many men seek medical help when problems become unbearable, but this attitude can delay the diagnosis of serious conditions such as benign prostatic hyperplasia, BPH, prostate, and even prostate cancer. The truth, as it is a small organ and located in a sensitive region, it can present symptoms that are easily confused with common urinary problems. However, these signs often indicate changes that need immediate attention. Early detection is essential, as it significantly increases the chances of effective and less invasive treatment, in addition to preventing more serious complications. Seeing a urologist annually is one of the best ways to take care of prostate health, especially after the age of 40. During these visits, tests such as PSA, prostate-specific antigen, and digital rectal examination can identify problems early, before symptoms even appear. This regular follow-up also allows you to discuss any questions or concerns, helping you stay healthy today. Remember, your health cannot wait. Ignoring the signs or postponing appointments can put not only your prostate at risk, but also your quality of life. Preventing is always easier and less painful than treating. Therefore, prioritize self-care, keep your appointments up to date, and pay attention to your body's signals. This is the best way to ensure longevity and well-being. Prostate health goes far beyond avoiding diseases. It is about ensuring an active, full, and unlimited life. Small daily choices can make all the difference to your long-term well-being. Reducing alcohol consumption, controlling caffeine, giving up smoking, adopting a balanced diet, exercising, staying hydrated, and of course, visiting your doctor regularly are simple but powerful steps you can start today. Remember, your quality of life is in your hands. Don't wait for problems to arise before taking action. Invest in yourself, your health, and your future. By taking care of your prostate, you are not only preventing diseases, but also ensuring more energy, autonomy, and happiness to live each moment intensely. Now it's your turn to make a difference. Start the change now and inspire other men to do the same. After all, your health deserves this priority.